I'm Eden. With me is my awesome coworker, Amanda. We're glad you're here today. And we also have the pleasure of working with Marcie Maisonet today. Marcie is the owner of Bayside Insurance Group. She's a licensed and certified insurance specialist who has been providing A-plus rated insurance products to individuals and families since 2008. Marcie was born and raised in the Tampa Bay area and has grown her agency nationally over the last 17 years. She has served as a high-end consultant for several insurance carriers and has won many awards for her achievements in customer service. The Bayside Insurance Group currently employs over 500 agents nationally and is consistently growing their market, which includes individuals and businesses in need of Medicare, life, and dental insurance. With Bayside Insurance Group, Marcie has excelled in business by being consumer focused and by educating her clients on all of their insurance options. Her mission is to provide quality and affordable insurance benefits to the individual and group marketplace. Marcie believes that there is no substitute for a strong work ethic while serving all of her clients with respect, dignity, and appreciation. We are so glad you're here today, Marcie. Welcome.
Thank you. It's been a challenging last week because we've been, in the eye of the recent hurricane that came through. So fortunately, we were one that, kept power and stuff on. So our place shares the power grid of one of the local shelters in the area. So ours is last to go off, I have to say. And through the past few storms, we've kept power. So that's good. I know a lot of families weren't so fortunate as what we were. So we're excited because, kids and stuff, everybody gets back to school this week. It's the longest they've been out for a hurricane ever. So
We can go ahead and get started. Thank you.
awesome. Basically, essentially what I do is I provide educational seminars on Medicare. And I do this every year to our local community and, different organizations, and basically bringing the updates that we've been informed as far as any changes that happen with Medicare, because, we all know that there's changes from one year to another, deductibles, Part B expenses, things like that. So this is the time of year that all the commercials start to run. Usually that means all the seminars and webinars start taking place also. So it's a really great presentation, and it's up to date at this point for everything that Medicare has released. I have, done a little bit of additional research, just as far as Parkinson's go. So I've included that in the slideshow, but I'll try to, I won't speed through it, but I'll try to, go slow so everybody can kind of understand it without making it too long of a presentation. So for now, Medicare and Parkinson's, 90% of Parkinson's patients are covered by Medicare. This can affect a person, hang on. I'm having microphone issues, so it likes to update me that it's not completely working. But 90% of Parkinson's patients are covered by Medicare. So managing Parkinson's, I know, is very overwhelming. So part of what we do is try to make it a little bit easier for everybody to understand. Hang on. All right, doctors such as primary care specialists, medications, physical therapy, all of that, rolls into a type of coverage that you receive. Selecting the right plan can be confusing. And of course, what we're here to do is try to help, navigate through this time to make it as least as confusing as possible. So what we're here to help you do is understand your Medicare choices, unravel the mysteries of Medicare. I know there are many, so you can ultimately make the right choice. So the first question, this is the million-dollar question: what is Medicare and what are my choices? So the basic overview of Medicare is that Medicare is a health insurance program. It was established in 1965. Provides health coverage to millions of people nationwide, people who are 65 and older, people who are disabled, and people who are in permanent kidney failure. all qualify for original Medicare. There is an initial enrollment period. Now, a lot of you will see, different programs that are available this time of year, such as Medicare Advantage, which is known as your Part C of Medicare, and also your Medicare Supplements, which is your Medigap plan. With Medicare Advantage, you can apply 3 months prior to turning 65 or 3 months after turning 65. So you really have a 6-month window for your initial enrollment period. Medicare supplements, with these applications, they can be taken up to 6 months in advance of your Medicare effective date. So if you're 64 and a half and above, and you cannot currently be on a Medicare supplement disability policy, if you are, you just don't have the ability to apply 6 months in advance. Essentially, it's more of like a 60-day turnaround time. But that's your initial enrollment period. There are 3 different parts to Medicare, and a lot of you will be familiar with the 3 different parts. The first part we'll talk about is your Part A, and this is your hospital insurance. This helps to cover inpatient care while in the hospital. Also, skilled nursing facility, hospice, as well as home health care. All of this falls under your Part A. Your Medicare Part B is often referenced as your medical insurance. This is where your doctor's services, hospital outpatient care, also home health care, preventive services, all of that falls under your Part B. So that's your medical insurance. So we've got hospital and medical. And then the third part to Medicare is your drug program. That's your Part D. This is run through Medicare approved private insurance companies. Ideally, Part D helps to cover the cost of prescription drugs to protect you as the consumer from higher costs in the future. There have been some, kind of bigger changes coming up for 2025, especially relating to the Part D. So we'll get into that in just a few minutes. Medicare Part C, this is also known as your Medicare Advantage plan. There's a lot of solicitation that comes out this time of year, a lot of, info commercials, just everywhere you turn around, at the supermarket, you've got everybody kind of geared up around Medicare Advantage. Some of the solicitation that you receive will talk about Medicare Advantage as Part C of Medicare. They are talking about one and the same product. It's not 2 different products, and I think there's a lot of confusion on that, but it's one and the same. With Medicare supplements, you must stay on your original Medicare Part A and Part B in order to get a Medicare supplement or a Medigap plan. This will only work with your original Medicare. So basically, you have your Part A, your Part B, that comes on your red, white, and blue card in the mail. And then your Medigap and Medicare supplement is an optional plan that you can purchase separately. And then your drug program. Sometimes your drug program, it can be optional in the event, say maybe you're a veteran and you have coverage from the VA. Well, Medicare considers VA coverage credible, so it's not always necessary to pick up a separate drug program, especially if you have VA coverage. And on the flip side of that, if you don't have VA coverage, then you will definitely want to get a drug program, because that's where your prescription drug coverage will be. With Medicare Advantage, this is kind of a similar slide. It will include your hospital coverage. It also includes your Part B, which is your doctors and your diagnostic. And usually Medicare Advantage will also include your Part D. They call that an MAPD, for Medicare Advantage prescription drug. But let's say, there's a person and they're a veteran and they still have their prescription drug coverage from the VA, then Part D is optional, even with a Medicare Advantage plan. You just want to make sure, when you set everything up, that you're compliant to what Medicare is requesting. So you have your whether it's a Medicare Advantage plan or whether it's to stay on original Medicare with a supplement, you would just want to make sure you get the drug program if you're required to have it. You cannot go into and join a Medicare Advantage plan and also purchase a Medicare supplement insurance policy. So these two do not run together. With your Medicare Advantage is basically replacing your original Medicare that the government gives to you as Part A and Part B. And then your supplement, you would stay on original Medicare and have the secondary policy. So when you go to the doctor, you would, in theory, present two cards, your red, white, and blue card, which is your Medicare card, and then your Medigap or your secondary policy. So that's your primary and your secondary. If you choose the direction of a Medicare Advantage plan, everything just comes on one card. It's your drug program, your hospital, your doctors, everything's just one simple card. So when we talk about your Medicare Part A for your hospital coverage, this is automatic enrollment if you're receiving your Social Security benefit check. You are eligible at the age of 65, or if you've been on disability for 2 years. For most people, it's premium free if you're eligible for Social Security or railroad retirement benefits, or if your spouse had Medicare covered government employment. So a lot of times, most people that I come into contact with will not pay for Part A, their hospital coverage. It's premium free. When we look at coverage, you have inpatient hospital room and board, skilled nursing facility. This is really important because Medicare does not cover long-term care. And a lot of people, they don't understand really the difference between a skilled nursing facility and a long-term care facility. A lot of these facilities are kind of the same. It's just with skilled nursing, it's all about coding. Let's say you were to have a knee replacement and you went somewhere, needed a couple weeks of skilled therapy, then you would return to your living situation, go back home. Long-term care is more of like a nursing home. It's more of a long-term stay where you will not be going back home. But Medicare does not cover long-term care. They will cover the skilled nursing facility. Hospice care does fall under Medicare Part A for coverage. Some home health services, blood is also included. Now, when we look down, we look at the out-of-pocket costs. I'm just going to bring up all three of these little slides. With hospital coverage, right now, this is subject to 2024. So Medicare updates, sometimes they're slow with their updates, I'll be honest. They should be updating this by, I would say, the first, maybe second week in November. So for now, I'm just going to go over, what it is that's known from Medicare. With hospital coverage, with just original Medicare, in the event you're hospitalized, your initial responsibility is the first $1,632. So that's not factoring in any Medicare Advantage. That's also not factoring in secondary coverage like a supplement. So your initial out-of-pocket responsibility in the event you're hospitalized from day 1 through day 60. So if you're there 3 days, your responsibility is $1,632. If you're in the hospital 30 days, your responsibility is still $1,632. 1 day in the hospital, $1,632. In the event you're hospitalized from 61 to 90 days, your responsibility as a patient is $408 per day. From day 91 to 150, your responsibility is $816 per day. Hospice care, we know you have 6 months coverage for hospital or hospice care. They do give extensions in the event someone were to need an extension. So if you say there were 9 months of hospice care, they will grant the extension, in the event it's needed. Skilled nursing care, there is a minimum of a 3-day hospital stay in order to access the skilled nursing care benefit. If you are in observation for 1 day, and hospitalized for 2 days, that does not equal 3 days because observation does not count as day 1 of hospitalization. You actually have to be admitted. So once you're admitted and you're there 3 days, the first 20 days are covered by Medicare. Beginning at day 21 through day 100, your responsibility is $204 per day. You know, when you look at the out-of-pocket costs with just original Medicare Part A and not factoring in any secondary insurance or any advantage plan, some people I talk to just have original Medicare. When that happens, if there's a catastrophic situation, then they're ultimately, you know, on the hook for around $50,000 or $60,000 patient responsibility. You know, and that's all only Part A for hospital coverage. So for Part B, the medical portion, you can delay Part B enrollment if you are currently enrolled on an employer-sponsored group medical plan. Your monthly premium, this is deducted from your Social Security check. Some people that I talk to are like, I don't have Social Security, you know, how do I make the payment? So you'll be billed, and Social Security bills you for Medicare per quarter. So you get a nice 3-month bill 4 times a year. This is income dependent. So in the event, say you have, you know, you sell a property or you have other sources of income, maybe you're a business owner and you're on Medicare, this can be a little bit higher for some people, but the standard is $174.70, and that will cover your Part B premium. That's your very first Medicare expense, is your Part B premium. You can enroll 3 months prior to turning 65 and also 3 months after turning 65. So you really have a 7-month window that you can enroll into Part B of Medicare. So Medicare Part B, if we basically break down coverage, you have doctor services. This will be primary care, specialist coverage, outpatient care, even if it's in a hospital environment and it's considered outpatient, it will still fall under your Part B of Medicare. Preventive services like flu shots. I know a lot of people are getting flu shots this time of year, so that is a covered benefit by original Medicare. Ambulance services, some additional immunizations, cancer screenings, chemotherapy, diabetic screening and supplies, durable medical. This would be wheelchairs and walkers. There's limited chiropractic, vision, and hearing under original Medicare. You will have also occupational therapy, physical therapy, speech therapy, mental health services. All of that falls under Part B. Now, when we look at out-of-pocket costs, so the very first expense is the $174.70, and this is automatically deducted from Social Security or billed to you if you don't draw Social Security. Medicare has a Part B annual deductible. So that's a deductible that you pay 1 time per year, and then it's done. You don't pay it again as long as you're on original Medicare until the following year. Right now, that deductible is set at $240. After that initial $240, Medicare then kicks in and pays 80% of approved charges. Patient responsibility is 20% of those charges. And again, this is with just keeping Medicare as straight Medicare. The thing about the Part B, which is similar to the Part A, because we know with Part A, if there's a catastrophic situation, you're looking at about $50,000, maybe $60,000 patient responsibility. With your Part B, this is an open-ended 20% of costs. So if there's, you know, say you're diagnosed with cancer and you have surgeries, chemo, radiation, and the bill is $400,000, you will ultimately be responsible for 20% of that bill, as long as Medicare approves those charges, which this is really important to you know, basically let you know you have to get some sort of secondary coverage in place. That way that secondary coverage protects you from this 20% of overall expenses. Now, moving to Part D, you know, this is the prescription drug. you must have original Medicare Part A and Part B in order to get a drug program. Some people, that only have Part A, I talk to them all the time. They don't want to pay the expense on Part B, or maybe they live in another country and they're like, well, I only come to, even though they're a citizen, they only come back every 3 months or 3 months out of the year. So maybe they don't enroll in Part B. In order to get a prescription drug coverage plan, you must have Part A and Part B. The drug plans are guaranteed acceptance, so you can get them with a Medicare Advantage plan. You can also get them as a standalone prescription drug plan. So they're available both ways. For some people that get the MAPD, Medicare Advantage prescription drug, or the people that decide, well, let me stay on straight Medicare, let me get a secondary, you can just get the standalone drug program. And then you have 3 cards essentially, because you've got a card that basically covers everything. In the event you do not enroll when you're initially eligible, you may pay a penalty. So a little bit earlier, we had talked about the veteran, remember, and the VA coverage that allows you to have drug coverage with the VA. Well, Medicare considers that VA coverage compliant. So that person can, of course, waive the drug program because they have it with the VA. If there's a person that's not a veteran and you elect not to get a drug program, then in the future, when you decide to enroll in the drug program, there will be a penalty. And that penalty will be factored in by the amount of months that you went without a drug program. It's not years. So if you're without a drug program for 2 years, you'll have a 24-month penalty. So you'll have the penalty if you don't enroll when you're initially eligible. So when we look at out-of-pocket costs for the drug program, premium is the biggest thing. This will vary based on the company and plan that you choose. The deductible, a lot of the plans that are available with the drug programs have a deductible. There are some that do not have a drug deductible. Medicare sets the deductible. It's not really set by private insurance companies, although the insurance sector, they can offer you a lower deductible. So they may say, okay, well, we're going to make it $560 for the year. So as long as they come under the threshold, at or under the threshold as what Medicare kind of sets it up to be, then they can offer lower deductibles or no deductibles. The initial coverage phase, this is where a lot of the changes for next year are happening. So, for those of you that are on Medicare now, you've probably heard the donut hole as a term. What the donut hole is basically it factors in what you pay, what the insurance company pays, any deductibles, and it adds up to right around $5,000. When you reach the donut hole, you're paying roughly 25% the cost of your medication until you reach what's known as catastrophic coverage. That catastrophic coverage kicks in at around $8,000. Then you're paying 5% the cost of your medication. Well, the good news is that the donut hole for next year is actually going away. So if any of you have had the opportunity to kind of look through the benefit plans, you'll see that there's no donut hole for next year. The initial coverage phase will include your deductible. So we'll just say it's $590 per year. And then sometimes you'll have a copay. Like if your medications are broken up into 5 tiers. You have your tier 1 and your tier 2. These are your lower cost generic medications. A lot of times these run through copays. Like you may pay 0 for tier 1s, or maybe $5 for tier 1s and $10 for tier 2s, because those are your generics. Anything you pay out on your drug program will apply towards a maximum out of pocket of $2,000. Once you reach that $2,000, that's now considered you've met your catastrophic phase. So after $2,000, as long as Medicare and the drug plan is covering those medications and they've approved them, then your out-of-pocket cost will be nothing for those medications because you've met your $2,000 threshold. You will still have to pay your premium. That's, monthly. But once that $2,000 in medication cost is met, then the insurance company kicks in and pays 100% for all the covered medications. It's a really great program, what they've done as far as discontinuing the donut hole. We have seen some increases happen because that donut hole is no longer there. So the increases, have basically adjusted all the premiums across the board once that donut hole went away. So Medicare Advantage, so we're going to get a little bit into the Medicare Part C. You can join or switch plans only during certain times of the year. These Medicare Advantage plans, they must cover at least what Medicare covers. It doesn't have to cover them in the same way Medicare covers them. It just has to offer coverage. For example, the hospital coverage. Well, we know Original Medicare has a deductible of $1,632. So with Medicare Advantage, they may say, for example, we're going to cover you may have a copay for the first 5 days of hospitalization, and your copay may be $395. So they're not copying the deductible on what Original Medicare is. They're still offering coverage for hospitalization. They're just breaking it into a little different copay. Some plans charge small monthly premiums, other plans do not. In the past, a lot of Medicare Advantage plans were premium free. This year, we're getting away from that a little bit. There are definitely still some plans that are free, but some of them now charge a small monthly premium. I've seen some that have a $16 premium or a $28 premium, and there's still a wide number of them that are premium free. So the maximum out of pocket, this will vary by plan, but it can go up to around $10,000 per year per person. So this is an expense that you definitely want to budget for if you're in a Medicare Advantage plan. In the event you're in an HMO, a lot of times, especially, during the annual election period, you'll see a lot of commercials or advertisements come in for HMO plans or PPO plans, POS. There's, everything with Medicare is kind of lettered, so they don't make it easy to understand. The HMO plans are a limited network plan. The PPOs will include in-network and out-of-network coverage. So depending on your plan, you may not have a $10,000 out of pocket. If, say, you're on an HMO, you may only have a $3,000 out of pocket, but you have zero access to providers that are out of the network. So someone says to you, oh, Dr. Smith is the best at, this specialist is the one you want to go see, and he is out of network to your plan. If you are on an HMO, you will not have access to that provider. The PPO will give you out-of-network coverage. It just comes at a higher cost. So your out-of-pocket will jump up, from whatever it is on the HMO up to over $10,000 per year on a PPO. So some plans have certain rules to follow, like referrals. This is a big one because I talk to a lot of people every year, and one of the most frustrating things that they have to go through is getting referrals from their provider. And granted, it's not every single provider, every single primary care that they go to is, it's not always, you don't always have to bite teeth, it seems like, to try to get a referral to a specialist. There is a great number of providers, though, that it's very difficult to get a referral to see a specialist. And the one thing that you don't want to have to argue with the primary care and really you don't want that headache necessarily of trying to see a specialist. If they're the best at the industry, having access to those providers are very important. So you have to use providers who belong to the plan, especially on the HMOs. Anytime throughout the year, insurers can opt out of these plans. Doctors can also opt out of these plans, and hospitals can opt out of these plans. So let's say you start a new Advantage plan in January. All of a sudden, you go to your doctor in February and you see a big sign that says, "We no longer take X and X insurance." Well, now starting, say, March 1st, now your doctor that maybe you've been seeing for 8 years is now no longer accepting these plans. That's one of the biggest struggles with Medicare Advantage that a lot of people have, is that the insurers opt out of the plans, doctors, primary care specialists, even hospitals, or maybe one of the major facilities in the area that's known to treat certain things like cancer. It can happen in a wide range of scenarios. Benefits and premiums can change annually. And again, you cannot have a Medicare supplement and also a Medicare Advantage plan. They will not work together. These are not guaranteed renewable. So every year, especially during the, annual election period, these notices are sent out about how your Medicare Advantage plan is changing for the following calendar year. So when they renew, they don't always renew the same way. The doctors may fall out of network. The co-pays change for doctors. Hospitals change. Some of the extra benefits that are built into the Medicare Advantage plan, like dental or vision or hearing aids, a lot of this type of coverage moving into next year is lower than what it's been in previous years. So as we're rolling from one year to another, they're not guaranteed renewable to continue coverage in the way that you've had it in past years. So you have to be more open to change. With Medicare supplements and Medigap plans, there are 11 standardized plans available. These plans are available nationally. So you have from Plan A all the way to Plan N. Your most comprehensive plan for someone who is new to Medicare is Supplement Plan G. This is like your Cadillac of supplements. In the event, say you've been on Medicare for 10 years or 5 years, if you've had Medicare established prior to 2020, so 2019 and before, you will still qualify for Supplement Plan F. F as in fabulous. Supplement Plan F and Supplement G are very, very similar plans. What happened with F, I guess almost 5 years ago is, Congress, they're trying to salvage Medicare, make Medicare last longer. So they decided to discontinue Plan F. So people that have a Medicare plan end up paying, like for doctor visits, your Part B, they end up paying the first $240, which is your Medicare Part B deductible. So they thought doing something like that would help save Medicare money in the long run. Because when you're on Plan F, I have to admit, it's very convenient. Your hospital deductibles, hospital Part A, your Part B deductibles, your 20% after that Part B deductible is met. Everything is covered under Part or Plan F once Medicare approves it. So it's a beautiful plan. With that being discontinued, Plan G has essentially rose to first place, I guess, and Plan G is now that Cadillac of plans. It is most comprehensive as far as doctor visits, as far as hospital coverage goes, your MRI, CT scans, just every aspect that revolves around Part A and Part B of Medicare. So all Medicare supplement plans are guaranteed renewable. So with that being said, every year, you'll see that Medicare changes those deductibles, for hospital, for doctors, the Part B, everything, all of that changes. And so does Medicare Advantage. With a Medicare supplement, which is also your Medigap, these plans are designed to offset whatever changes with original Medicare. So right now we know Medicare Part A, that deductible is $1,632. Let's say Medicare changes it to $1,650. Well, if you're on a supplement that has coverage, like for example, G, we'll just use G as an example. Plan G automatically pays that Part A hospital deductible. So if it's $1,632, if it's $1,650, if it's $1,600, if it's $1,900, it doesn't matter, because the supplement plans automatically adjust to whatever those changes are with original Medicare, and it happens all on its own. That's a great benefit, and that's what you get when you choose the direction of a Medigap and Medicare supplement, is it adjusts to those changes. You'll have the flexibility, the freedom to choose your own doctors. So you can go to any doctor, any hospital, any specialist, anywhere in the country that you choose to go to. It does not make a difference whatsoever. If you want to go to Mayo Clinic in Rochester, or if you want to go to MD Anderson or Sloan Kettering in New York, you have access to any doctor, any hospital, any specialist, anywhere in the country that you choose to go to. There'll be nobody, no insurance company, nobody's going to stand in your way from maybe getting a second opinion or going to this doctor or that doctor or this hospital. You'll have access to everybody. There's no referrals. There's no networks to follow. And I think that's really important, as we get into these different, maybe limited benefit plans, the fact that you have access to go to any facility that you choose to go to without having to worry about referrals, it's almost unheard of, with healthcare in this day and age. Supplement plans. This is a great slideshow because this shows you from Plan A to Plan N. This will actually go over in detail. All the check marks will be where these supplements pay and have coverage for these benefits. So if you look down at, let's talk about Plan N. Plan N is a very popular plan also. But what Plan N does, you see for Part B medical expenses, Plan N offers you a copay, whereas Plan G offers 100% coverage. So what that means is Plan G pays anything that's billed under that 20% of Medicare. Then once Medicare approves it, Plan G steps in and pays that doctor, pays that outpatient facility. Plan G pays everything on your behalf. Plan N will offer you a copay for doctors. So it's a little bit more like traditional insurance, just on the standpoint of Plan N offering copays. A lot of people that come from like an employer plan or maybe the individual market, a lot of them are used to having, a $15 copay for primary care, or maybe like a $40 or $50 copay for specialists. Plan N is set up similar to that, because Plan N will offer you a $20 copay for all doctor visits, whether it's dermatologist, neurologist, any specialist, cardiologist. You will have to pay up to $20. In the event, say you were to go to a primary care doctor and Medicare pays their portion and you may have $15 left over from the visit. So you won't pay $20 if the leftover is only $15. You will be billed just the $15. So when they say up to $20, that's the most you will pay in any doctor visit scenario, is up to $20. But Plan N is also a good plan. Now, when you look down, you've got your Part A deductible. You see a lot of checks across the screens. That just shows there's coverage on all these supplements. Part B deductible, this is where you'll see Plan G does not have a check. That means you pay the Part B deductible if you're on Plan G. And Plan F, you'll see the Part B deductible is paid for. So somebody's on Plan F, they go to the doctor, say Medicare, doctor bills Medicare, the amount's $100. Plan F pays the $100. Plan G, that $100 applies to your $240. So you would pay the 100. You do that a couple times, eventually you've satisfied the $240. And then it rolls into your Part B of coinsurance, which on Plan F and G are 100% coverage. One big area that I want to talk about is your excess doctor charges. You'll see this is not somewhere that's covered under every single benefit plan for the supplemental. It only comes really in 3 plans. You've got your Plan F and you have your Plan G. Plan G offers a deductible version, which is a little bit cheaper than regular Plan G. They call that the high deductible G. What your excess doctor charges are, Plan N does not cover excess doctor charges. That is essentially your out-of-network Medicare providers. There's only about maybe 5%, possibly 10% of providers across the country that are not in Medicare's network. If they're not in Medicare's network, that is considered excess doctor charges. Plan F and Plan G will cover 100% of those excess doctor charges. Plan N, you will pay those excess doctor charges. So an example of a facility that does not accept Medicare's network is Mayo Clinic. In the event you say you wanted to get a second opinion or you wanted to receive treatment from Mayo Clinic, then that does not mean they will not file Medicare. They will file Medicare. Medicare will pay them the network rate. Whatever is left over is considered balance billing. You will be balance billed the difference on Plan N because there is no benefit for excess doctor charges. Whereas if, say, you have Plan F or Plan G, you will have 100% of that coverage accessible to you at Mayo Clinic. So, I mean, at that point, when you start, looking at Plan F or G or Plan N, I mean, if you want facilities that are the high-end facilities like the teaching hospitals, if those facilities are important to you, I would strongly urge you to consider a Plan G or possibly even a high deductible G or Plan F, if you're one of the ones that will qualify for Plan F, because remember, that's the discontinued plan. But I would strongly encourage you to consider those plans if those higher end facilities are important, because if your balance billed the difference, that could be very costly. I actually knew a gentleman one time. He was a friend of mine, but he was an agent, and he ended up, the coverage he had was TRICARE for life. TRICARE for life was phenomenal. I have no complaints about TRICARE whatsoever. He was military, retired military. So some of you are probably wondering, well, can I get TRICARE for life? He was military, so it's not available to everybody. But one thing about, TRICARE and some other of our benefit plans is that you have to follow Medicare's network. If you go out of network, TRICARE, some of these other options do not offer coverage out of network to Medicare. So he ended up having like a triple bypass, just $150,000 procedure at Mayo Clinic. He was billed the difference. And he wasn't aware that, and this was 15 years ago or 10 years ago, it was a while ago, but he didn't know, he thought TRICARE covered everywhere. So what ended up happening is he got the bill and he was able to work out a payment plan with Mayo Clinic. Of course, that's one situation of being out of network to Medicare that happens. If you stay focused on and stay in Medicare's network, then that situation won't happen to you, because Medicare's network on a national level covers 90% of providers. Moving on to foreign travel, there are many of the supplements that do cover foreign travel. So it's not always necessary to pick up a traveler's insurance. And then when you look at like the high deductible G, you'll see that the calendar year deductible and max out of pocket on the high deductible G is $2,800 per year. So the high deductible G is cheaper than going the regular G plan route. It keeps you on original Medicare. It incorporates a deductible of $2,800, but it still gives you the accessibility of all the doctors throughout the country, the network referrals. You don't have to worry about, any of that. So how are Medicare supplement plans priced? This is, I'm in Florida, so in Florida, a lot of these, like all the supplements here are priced issue age rated, which means the age that you are when you enter the policy is the age you're always rated at. In other states, a lot of the states that I work in are also attained age, which means that your rate will change as you get older, as you have a birthday, your rate will readjust. So if you're 80, you're going to be readjusted to an 80-year-old rate. There are a good handful of states, though, that are issue age. So let's say you started a supplement at the age of 65, then you lock in that 65-year-old bracket. And even if you're 75, you're still receiving a 65-year-old rating. That doesn't mean rate changes and rate increases. That doesn't mean those changes don't happen. It just means that if you're issue age, you've locked in your age, and those rate changes will be occurred. Like if you're 65, then even if you're 75, you'll receive the rate change of a 65-year-old. Outside of that, claim activity also plays a factor in your rate. Gender. So males and females will pay different rates. Preferred rates and non-preferred rates, which are considered standard rates. One standard is smoking, preferred is non-smoking. So let's say you have, a person that has maybe 30 different medications and they're a non-smoker. Then you have another person that's a smoker and they have 30 different medications. You're not going to be rated based on your medication usage or what your pre-existing is. It really comes down to gender, your demographic area, and whether you're a smoker or whether you're a non-smoker. So what rate adjustments does, what it implements in the long run is that it helps to keep pace with rising Medicare claim trends. A lot of people are living longer, so therefore rate adjustments have to, compensate for that. Changes in annual deductibles. When Medicare comes in and Medicare adjusts the hospital deductible or the Part B deductible, whatever it is that they're changing in the deductibles, that could ultimately adjust the premiums on the supplement plans. And that can be higher, that could be lower. Believe it or not, there are some carriers that drop rates from time to time. I know you don't believe me, but it's true because I've seen it happen. With Medicare supplements, there is an open enrollment qualifier. So this is what's required in order to have a supplement. So you must be enrolled in Medicare Part A and Medicare Part B, the same as you would if you were on Medicare Advantage. You have to have Part A and Part B of original Medicare. Within 6 months of turning 65, you have an open enrollment period. That means you can't be denied based on health, and you can apply for coverage up to 6 months in advance. It will not start, though, until the month that your Medicare starts. So if your birthday is in February of 2025 and you apply now, the effective date will be February of 2025. You cannot be denied during open enrollment or charged more because of your health. Now, there's something known as a guaranteed issue qualifier. If in the event you are involuntarily disenrolled from your employer-sponsored group medical plan, what that means is that, say you were working with whatever, with such and such company for 30 years and you retired with them. And then all of a sudden they decided, I am no longer able to cover your benefits on a retiree plan. We have to end your benefits, which means you will be put back on original Medicare. If that happens, regardless of your health condition, you will be considered guarantee issue for a Medicare supplement insurance policy. Also, if you are involuntarily disenrolled from your Medicare Advantage plan, Occasionally, there's an Advantage plan that might be popular one year, and then all of a sudden, the insurance company comes in and says, well, we're going to be discontinuing your plan for 2025. They send you a nice, lovely letter that says you have to enroll in something else, or you will be on straight Medicare starting January 1st. So those letters are basically it's like a golden ticket, because those letters allow you to get any Medicare plan, even if there's underwriting, that you can get those plans and bypass all underwriting. So let's say you have a pacemaker, or maybe you're currently undergoing cancer, or you have a medical situation that wouldn't normally be treated as a situation that's insurable by the insurance market. If your coverage ends due to no fault of your own, you are eligible to get any policy that you choose to get without underwriting. Outside of these scenarios, so turning 65, you have 6 months before, 6 months after turning 65, or if you are involuntarily disenrolled from your employer plan or retiree plan or even Medicare Advantage plan, you must go through underwriting outside of these enrollment periods. If you are, say your spouse has been working and your spouse is maybe younger than you or older than you, and they just continue working until, say, 7 years later, and then you decide, well, it's time for me to go on Medicare, but I'm not 65 now, maybe I'm 75. Well, if you've never had Part B of Medicare issued, and now say maybe now you're 72, you're coming off the employer plan, now you need Medicare, you are still guarantee issue. They consider that an open enrollment period for you, and you'll have 60 days from your Part B effective date, and you can bypass all underwriting. So your health in that situation does not matter. So right now, there's an annual election period for Medicare, which will end December 7th. I was just notified actually today that if you were impacted by Hurricane Helene or Hurricane Milton, this period was extended. So they've created a special election period for those people that live in certain areas directly impacted by the storm. So not everybody will be subject to that December 7th deadline. A lot of you may, so you want to keep that date in mind. And if you're not sure if you fall in that area, you need to talk to someone and find out if that special election period will benefit you, because that just gives you a little bit of extra time. There is another open enrollment period for Medicare that will come from January 1st to March 31st, that you'll be able to do some changes in the event you needed to. How do you choose the right plan? There are many Medicare plans and prescription drug plans to choose from. The decision that you make today affects the quality of care tomorrow. And this is very important to understand. Because if you're in a Medicare Advantage plan, and say you're in a limited benefit plan, because you feel like, I'm healthy, and, this plan is going to, give me the needs that I have today, because I go to the doctor once, maybe twice a year. This is perfect. I'm saving money. And then, say sometime throughout the year, all of a sudden your health changes. Then you're stuck in that plan until the next enrollment period. Or if your doctor's no longer in the plan, it's not so easy to make changes, especially if your health has changed. And the decision that you make today affects the quality of care tomorrow. You want to allow yourself that access so you're not stuck in a limited plan should your health change or your circumstances change. Do you want the flexibility, the freedom to choose your own doctors? If Mayo Clinic, MD Anderson, Sloan Kettering, Cleveland Clinic, if these high-end facilities are important to you, then it's very, very important that you choose the right plan, because some plans will prevent you access to some of these higher-end facilities. So, and the same thing goes with specialists. Do you want to choose your own specialist without referrals, maybe without having to worry about networks? Do you want the best facilities available, like Cleveland Clinic, Mayo, all of those higher end facilities? Again, if those are important to you, then you need to really look at your plan and what options you have. If you travel, a lot of people travel, they go out of the country. A lot of people love cruises. I myself love cruises. If you want a plan that includes foreign travel, a lot of the supplements will give you a lifetime benefit of $50,000 for foreign travel. So, supplements included. So that's important too for anybody that travels. Will paying a lower premium help save money in the long run? No, it will not. So which carrier should you use? There's a lot of carriers, and all of these, 50 states that we have, that have different ratings. Some insurance companies have a B rating, some have a C. You always want to stick with a high rated carrier, like, an A or A minus or A plus, because that shows that, the company pays claims in a timely manner, that they actually pay claims. Because if you go with a C rated company, they receive a C rating for a reason. They may not be paying claims as timely or at all as what some of the A-rated carriers are paying. And you don't want that stress either. How long has the carrier been in the Medicare business? Every year I look through that Medicare and You booklet. I know you guys get that. They're always showing all these different companies. And if you look at last year's Medicare and You, there's different companies. So it's like they're constantly coming out with new carriers. So you want to look at that, because sometimes they're brand new. How quickly they issue policies and how quickly they pay claims, that will affect their rating. So why is choosing a carrier important? A lot of times I get the pleasure of calling customer service, and sometimes I talk to different places outside of the country. I think just the other day, I ended up talking to Barbados. And I take pride because, I'm in Florida on a non-hurricane year. That's pretty exciting stuff. It's like it's sunny, open enrollment, Medicare season's usually in winter time or in fall. And sometimes someone's has 30 degrees outside when I have 80. So it's exciting stuff. But then when I talk to Barbados, they're like, yeah, where are you? And I'm like, Florida. And they're like, oh, I'm in Barbados. I didn't even know there were call centers in Barbados, honestly. But there are selective carriers, that keep everything in the country. So you don't necessarily, get Barbados or any other out of the country areas when you call. All right, hang on, click something. So where and how would you get a Medicare plan? I would encourage you to, speak to somebody like myself, as a broker. There are agents, that represent certain carriers. I would say go with a broker, because it doesn't cost you anything to speak to a broker. And as a broker, we have access to, 15 different carriers, or however many carriers are in your state. Or in your area, we have access to all of them. So we're able to see the pros and cons. And as an agent, if you're calling such and such insurance company and talking to someone in their sales department, they will talk to you about all the great things about this one particular product. And you may not know the cons that come associated with that plan. So I think it's important, to speak to someone that can really go over all aspects of the good and the bad, considering you have so many options to go through. But that's where someone like myself, as a broker, we're able to do that for a lot of different people. I'm going to go ahead and open it up to questions now. So if you have any questions, I believe there's a way you can type it down at the bottom and you can ask.
I have been monitoring the chat. Thank you so much. I know we're over, but we do have a couple of questions, so I want to ask them quickly. Someone asked, what ratings are you referring to, and where can I find them?
So the ratings are, there's two different ones that I usually use. It's AM's Best and Standard and Poor. So those companies will actually rate the financial market and the insurance companies, and they'll give them an A rating or a B rating or a C. I believe you have to create an account, but it doesn't cost anything to do that. And they certainly don't ever spam you. I don't think I've ever received any spam, and I've been with them for years. But you can view their company ratings through those websites.
And I am going to put the Medicare.gov link. I was looking up what you were saying, so I could put that in the chat. Someone asked, what about once you reach the max out-of-pocket cost? And you were talking about the fact that we don't have the donut hole anymore.
On prescription drug coverage, if you reach the maximum out of pocket, which is that $2,000 per year, then as long as the drug carrier covers that medication, meaning it's on the formulary with that insurance company, then the insurance company will kick in and they will pay all of those medication costs moving forward for the rest of the year.
And what if you're still working despite being over 65? Is there still a penalty for Medicare Part D?
So that's a great question. If you're working and you are on an employer-sponsored plan, whether it's through you or whether it's through a spouse, then you are not required to file Medicare Part B. So you don't have to do any of that because you have credible coverage through an employer plan. So what I would have you do, though, what I do with a lot of my clients that turn 65, I would review the employer plan. And I can certainly help you with that if you have questions about it. But I would review the employer plan. You know, you want to look at how much it costs you. You also want to look at what the deductibles and maximum out of pocket is. Sometimes employer plans have a high deductible coverage, which means you might be on the hook for $10,000 and it might cost you $1,000 a month. Some people are actually better coming off of the employer plan and going on to Medicare with a secondary coverage, because the employer plan is not designed specifically to Medicare. It's designed for somebody who's in the under 5. So it's something you want to certainly look at.
And I have a couple of questions about, I guess, switching. So if you're in a Medicare Advantage plan and you want to leave it and get a Medicare supplement, can you? And someone also said, if you initially enrolled in an Advantage plan, can you switch to a traditional plan in 2025?
So you can, but if you're on an Advantage plan and you're looking to change to a supplement, then you will have to go through underwriting to see if you qualify. If you have questions about whether or not you may or may not qualify, and if you know, my phone number is listed here for everybody. If anybody has questions about qualifying or just anything about the presentation, you're more than welcome to reach out to me because I'm happy to go over any of your questions too. But your underwriting, if you have Medicare Advantage, you can go onto a supplement, but you will have underwriting.
Well, we are out of time, so I am going to stop here. I do encourage people, if they have questions, to reach out to Marcie. I cannot thank you enough. This was so informative. Marcie she did offer to share her slides, so that will also be available, because I know that one grid was incredible. I know people are going to want to study that more. Real quick though, because somebody did ask if you could just explain the grid a little bit, what the percentages mean. Because like some of them said 80%, does that mean 80% is covered, you're responsible for 20%? If you could just clarify that.
So with Medicare, under the Part B of Medicare, the coverage, as the coverage is outlined, you have the Part B deductible, which is that $240. Then Medicare pays 80% of approved charges, and patient responsibility is the 20% of approved charges. That's just going along with original Medicare. The secondary policies, of course, will, depending on which one, you know, Plan N versus Plan G, they're kind of designed to do different things, but they will kick in and they will offset that 20% that Medicare pushes on to patient responsibility.
Perfect. Well, thank you again. This was so wonderful. We have a tradition here at PMD Alliance, our wave of gratitude. I just want to say thanks to everybody. And thanks for joining us. Marcie, thank you so much. This was excellent. And I hope everybody has a wonderful day. Bye, everyone.
Bye.